If you're pregnant or just had a baby, or even years postpartum, then this video is for you. Hi everyone, I'm Dr. Nabila Noor, a urogynecologist and a pelvic reconstructive surgeon, and I talk about women's pelvic health every day. And part of my job is to help women understand how childbirth and pregnancy can affect their pelvic floor. Because trust me, it's not just about labor pain and stitches and episiotomies. Your pelvic floor takes quite a hit during pregnancy and when you're delivering a baby, which can affect how you pee, how you poop, how you can be intimate, and even how you can walk. So today, I'm going to break it down for you about what actually happens to your pelvic floor as you go through pregnancy, as you go through childbirth, and also in the postpartum period. And stick around till the end, because at the end, I'm going to share with you the number one thing that women miss that can really help improve their pelvic health in the postpartum period. Now, before you dive in, I have a quick favor to ask of you. For those of you who have been following me for some time and enjoying my content, please, if you haven't subscribed to my channel, please do so, because only a few percentage of you actually are subscribed to my channel. And if you're already subscribed, then don't forget to hit that notification button. So let's start with, what is the pelvic floor? So the pelvic floor is a group of muscles, connective tissue, ligaments that help support your pelvic organs. Now, what are the pelvic organs? That could be the uterus, which is where the baby is growing. Then there's the bladder, which stores urine. There's rectum and intestines that holds your stool. Now, what happens during pregnancy? In addition to supporting these organs, there's also the weight of the baby, which can be anywhere from 6 to 10 pounds for a good few months. Now, on top of that, your body is also releasing hormones like relaxin and progesterone, which makes your pelvic ligaments and connective tissue loose. Now, this is great to help get your body ready for delivery and the process of labor, but not so good for your pelvic support. And then, of course, there's the blood flow. Your veins swell up, the pressure increases, and that's how you can end up with hemorrhoids and varicose veins, which nobody talks about. Now, let's move on to the process of delivery. Vaginal birth is one of the most beautiful things of nature, but it really does cause some trauma to your pelvic floor. Now imagine the vaginal opening, which is about 3 centimeters, now has to stretch to about 10 centimeters to accommodate the baby's head and the body being able to pass through. This can cause a lot of lacerations, which is tears. Sometimes we'll have to do an episiotomy where the surgeon or your doctors will make a surgical incision, which can also cause some damage to the muscles and the nerves. The pudendal nerve, which supports all your pelvic floor muscles, can also get damaged in the process of laboring. And if you've ever had a forceps or vacuum being used to help you deliver the baby, and that can add some added trauma to the pelvic floor. This is why many women leak urine after delivery, everything feels loose down there, nothing feels the same way, have difficulty with pooping. Now here's a question that often comes up in my practice. If I have a C-section, does that mean my pelvic floor is protected? I wish it was that simple. It's not, because a C-section is not 100% protected for your pelvic floor either. Because remember, the process of laboring is just one part of the equation. Just being pregnant, as we talked about earlier, can cause a lot of pressure, and during pregnancy, a lot of women can suffer from constipation, which can also cause a lot of pressure. So even though a scheduled C-section may prevent vaginal lacerations and tear down there, it doesn't mean your pelvic floor is 100% protected. And also, remember, a cesarean section is a major abdominal surgery. So don't take it lightly and think it's a free pass. It really is not. So here's the million-dollar question. What should you expect after pregnancy and childbirth? Immediately after childbirth, many women will complain of not being able to control their urine, feeling like they're having to run to the bathroom, feeling a lot of laxity, a lot of vaginal dryness, irritation, pain with intimacy, especially if you're somebody who's breastfeeding, as well as constipation, and for some people, not being able to control stool and gas. These are common, but let me be clear. These are absolutely not normal. And if you're somebody who's dealing with these symptoms way past 3 months after your pregnancy, then that's a time you should be seeing a urogynecologist so you can talk about how to manage these symptoms. Please don't suffer in silence. Please don't accept the fact that these are things most women go through, because in today's day and age, there are so many options that we can talk about. And that's why we have a whole specialty of urogynecology that is dedicated to women suffering with these pelvic floor issues. So what are some things that you can do to help prevent some of these conditions or improve them? Number one, pelvic floor physical therapy. Not just any physical therapy, but pelvic floor physical therapy. Focusing on strengthening those muscles and improve the integrity of those muscles. A lot of the times when I talk to my patients about pelvic floor exercises, they just automatically assume it's Kegel exercises. Yes, Kegel exercises is a big component of pelvic floor exercises, but that's not all it is. Especially for my postpartum moms, there's a lot of breathing that we focus on, a lot of focusing on core strength, body mechanics, how you move, how you carry the baby, especially when you're breastfeeding them. How do you pick up a stroller? How do you pick up a baby carrier? All those are heavy things. And what your posture is, how you move, how you align your body, all those little steps make a huge difference. Number two, give your body the time it needs to heal. Don't rush into trying to get back to your pre-pregnancy weight immediately after your delivery. Remember, your body is going through not just physical trauma, but a lot of hormonal changes, which again leads to a lot of emotional changes. A lot of women may develop postpartum depression, so please do yourself a favor, be kind to yourself, talk to your doctors, a specialist, talk to your OBGYN, and if needed, get a referral to see a urogynecologist so that we can work together, come up with a plan to get you to recover in that postpartum period and get you to your pre-pregnancy body and get you to feeling the best version of yourself. And number three, there are treatment options that we can discuss, both conservative treatments as well as some surgical treatments that are minimally invasive. Not saying that surgery is for everyone, especially not in the postpartum period as you have a newborn baby, but it's helpful to discuss those options with your doctor so that you can mentally prepare yourself that this is not something you have to deal with or suffer for the rest of your life. So here's the truth. Pregnancy is wonderful. Childbirth truly is a miracle of nature, but understand it does put a lot of toll in your body. Whether you're having your baby in your 20s, in your 30s, or your 40s, it can affect your pelvic floor and you may end up with conditions such as urinary leakage, not being able to control stool or gas, pelvic organ prolapse. These are all common conditions that I see in my postpartum moms very regularly. 1 in 2 women with vaginal birth will have some degree of prolapse. Similarly, 1 in 3 women will develop some sort of urinary leakage. 1 in 12 women will have some sort of bowel issues and not being able to control stool. These are real statistics. But here's the thing that I want you to know from this video. All these things can be treated, and I treat them every day in my office and have many patients who have complete recovery and get back to their active life just like they had before their pregnancy. Hope you liked this video and learned something new from it. If you like the content and you haven't subscribed yet, please hit that subscribe button. Also, sign up for my newsletter, which I send out weekly with up-to-date, science-backed pelvic health tips. Stay well, stay healthy, and take care of your pelvic health. Bye.